Hello and welcome to your weekly health show, Health and Lifestyle, where we talk all matters health. My name is Marie Yambo, and at KBC Channel 1 on X is where you can interact with us. Spinal muscular atrophy, SMA, is a genetic disorder with an incidence of approximately 1 in 10,000 to 20,000 live births and a carrier frequency of 1 in 40 to 1 in 70 in the general population. It is a leading genetic cause of infant death. The disease is characterized by progressive muscle weakness and atrophy due to the loss of motor neurons. There are different types of SMA with varying degrees of severity and life expectancy. We'll be delving more into this rare disease. But first things first, let's get the highlights. Coming up in the program.
Any small amount will give baby Jason a future. It will mean that he'll be alive, next year and the year after that.
A race against time. Baby Jason needs 25 million shillings for life-saving gene therapy.
The gene therapy has been shown that if it's given, it's a one-time off gene therapy. So you replace the abnormal gene with a functioning gene. So the muscles do not degenerate, and so this patient can actually will have a normal lifespan.
Breakthroughs in SMA treatment. Gene therapy offers new hope for children. And on Good Practice today, we look at some of the signs and symptoms of SMA. Once again, welcome to the program. Baby Jason was just months old when he was diagnosed with spinal muscular atrophy. It's been over 8 months since he was admitted in the ICU as doctors race against time to save his life. Now, to save his life, baby Jason needs 25 million shillings for a gene therapy. His mother, Anne, now narrates. The Kenyatta University Teaching, Research and Referral Hospital Children's ICU section is where baby Jason has called home for more than 9 months now. When baby Jason was born, everything seemed normal. His mother recalls a smooth pregnancy marked only by typical nausea and increased appetite. Delivery was without complications, and mother and baby were discharged after 3 days in good health. There was nothing to suggest what was coming.
So when we went home, he was breastfeeding well. He was adding weight as expected, even from the clinics. He was generally doing well, adding weight, the height. He had said he was now able to hold his neck up, sitting with support.
However, during a routine clinic visit, the pediatrician noted that Jason wasn't putting weight on his feet.
When you hold him, you couldn't feel him bearing some weight. So the pediatrician just told us which exercises to do and to come back for review. But before even 1 month was over from the clinic date, he developed breathing problems. He was panting at home, so we went to the hospital. They diagnosed him with pneumonia, and we stayed overnight, but by the next day he had worsened and we were now admitted in ICU.
Despite antibiotics clearing the infection, Jason's breathing deteriorated.
His oxygen levels had dipped. He was struggling to breathe, so now they had actually put him on a ventilator.
A genetic test was eventually done, revealing the heartbreaking diagnosis.
We did a genetic test that confirmed that he had a genetic disorder called spinal muscular atrophy. We were shocked, just trying to process that. Of course, there was the denial part.
Spinal muscular atrophy, SMA, affects muscle strength, including the muscles needed to breathe, eat, and move. He was quickly admitted at the ICU to better manage his condition.
So they explained the reason we started seeing loss of motor function in the legs, in the breathing, is from the disease, and that he's likely to need support for breathing, for feeding, for walking, for moving with time.
The nurses here have become his second family, helping Anne, who has to juggle between caring for Jason and his older sister at home.
Baby Jason at the moment receives nursing care, so that is very important for him because it entails the suctioning part. As we saw, it entails dressing of the tracheostomy, the peg tube. We also have physiotherapists and occupational therapists to come over to just move his muscles, his joints, so that he doesn't get contractures. In addition to that, he's also nutritional support, being in hospital for long, being underweight, and the fact that he's losing a lot of muscle tone.
He can now play with the mom, with relatives, and even the other nurses. He's more interactive. He responds to smiles, someone talking to him, and even knows people now. He knows the mom and just his friends, basically. So we've seen a great improvement.
For babies with SMA type 1, gene therapy is the most effective treatment.
It's superior in the sense that from the tests that they've seen or from the trials they've done, they've shown that babies are able now to meet milestones and catch up with their peers, all the way to be able to walk.
And the window is rapidly closing for his treatment.
The gene therapy, in this case it's called the gene, is best administered before 2 years of age, and we're already 1 year and 2 months.
The journey has not been without some terrifying moments.
So there was this time when the tracheostomy had dislodged, and it was very difficult trying to put it back, and they had to keep doing chest compressions, resuscitating him, and honestly I didn't think he would survive. I was within the hospital, and I remember I was just crying to God and asking for another chance for him, and he pulled through. It was a miracle that he actually pulled through.
The tracheostomy is what he's using to breathe. So sometimes every 3 hours we sanction because it gets clogged with secretions. So for him to be able to breathe well and even be playful and also feed, we need to sanction, and that's what I was doing. It's just like removing the secretions using a tube.
Despite the challenges, baby Jason's fighting spirit gives his family hope.
From that incident, he showed me that for him he's ready to fight for his life, for his future, and therefore even I should fight for him also. Whatever is up to me, I do it, because even on his end, he's still holding on.
Now the family is appealing to the public, hoping to raise 250 million shillings.
Any small amount will give baby Jason a future. It will mean that he'll be alive, next year and the year after that.
Baby Jason is such a lovely boy, and if there's any slight hope that he can be able to grow up and be a big boy and even a family man sometime, we would really love for Kenyans to contribute and do that for baby Jason and also his family.
To support baby Jason, send contributions to PAYBILL number 8061567. That is 8061567. Account name is your name. That is the name of the sender. Indeed, baby Jason needs that life-saving therapy. And so wherever you are, whatever you can, just as the mother has said, it will go a long way in helping the family, plus saving baby Jason's life. So do something if you can. So on that note, we want to take a break, but we'll be back with much more, including the doctor just trying to explain more what this gene therapy is all about. Thank you for staying with us. We continue with the program. Now, spinal muscular atrophy, or SMA, is a rare genetic condition that affects the muscles we use for movement, breathing, and even swallowing. It happens because of a missing or a faulty gene called SMN1, which is responsible for producing a protein that keeps motor neurons, the nerve cells that control muscles, alive and working properly. Now, the good news is that the treatments have come a long way in recent years. There are now medications that can slow the progression of the disease, and even gene therapies that target the root cause. Let's get more from the doctor.
So, spinal muscular atrophy, it's a genetic disorder. So it's actually an inherited condition which affects nerves at the level of the spinal cord. And these nerves usually control muscle movement. So a patient with this condition will present with delayed milestones, and generally muscle weakness and muscle degeneration or atrophy.
Yes, so you said it's a disorder that affects muscle movement, but exactly which parts of the body that is?
So it's generally the muscles that involved in movement, like sitting, walking, head control. Also the muscles that involved in swallowing and breathing. So a patient with this condition will now have that delayed milestones, will generally be weak, delayed milestones. The child cannot support the head, will not sit or walk, and they also have difficulty breathing and difficulty swallowing.
At what point, at what age can this disorder be diagnosed?
So this disorder is actually classified depending on the age of the patient, age of onset of patients, the milestones the patient is able to achieve, and the severity. So we actually have 4 types of SMA. Type 1 is the most severe type of SMA, and this one will be diagnosed in infants aged between 0 months to 6 months, just before 6 months. So this patient will not sit. That's how we usually will never achieve sitting. They also have difficulty swallowing, difficulty breathing, and generally a very floppy baby who has difficulty from breastfeeding. Yes, so that's the most severe type.
Okay. Yes, a lesson in medicine, very short. I know it can be very complicated for our viewers, so we make it very simple. Let's go into the treatment of it. And I've also learned, talking to you and just the research that I've done, the earlier it is diagnosed, the better the outcome of the treatment. And here we are going to be definitely talking about baby Jason, who is one of your patients, and you've been able to manage him from the time of the diagnosis and all that. But just talk to us about how time frame is very, very key, because even for him, having turned 1 year, he needs to get the treatment before he's 2 years old. How key is that?
The SMA type 2 will be diagnosed in infants aged between 6 months and 18 months of age. It's less severe than type 1 in that this patient will be able to sit at the right time, that are allowed 6 months, but they don't walk. Okay. They may have the difficulty breathing or difficulty feeding, but it's less severe than the type 1. Then you have SMA type 3. This is diagnosed mainly in childhood after 18 months of age and to about adolescent age. These patients are able to walk and run, but over time, because of the progressive muscle weakness, they lose these milestones. But these children can actually read with supportive treatment, they can actually live to their adulthood. Then you have the adult onset, which will be diagnosed after 20 years. And these patients usually will have mild difficulties in walking and milestones, but they will be able to lead a normal life.
But what exactly, there's a protein that goes missing for us who are okay, and we are, we've never been to a medicine class anyway, so we wouldn't understand how the body works. But there is a protein that is actually responsible for how your muscles grow and you develop as an infant all the way to an adult. Yeah.
So the main problem with SMA is that we have a gene called SMN gene. SMN means survival motor neuron gene, type 1. This gene is responsible for producing a protein called a SMN protein. Now this protein is responsible for maintenance of the nerve cells known as motor neurons in the spinal cord and the brainstem. So if the patient has a faulty gene, they are not able to produce this protein. So the nerves progressively degenerate. So with the degeneration of the nerve cells, so the muscles, because now then the muscles become weak with time, they also atrophy and degenerate. So that's what causes the progressive muscle atrophy and weakness.
Okay. Yes, a lesson in medicine, very short. I know it can be very complicated for our viewers, so we make it very simple. Let's go into the treatment of it. And I've also learned, talking to you and just the research that I've done, the earlier it is diagnosed, the better the outcome of the treatment. And here we are going to be definitely talking about baby Jason, who is one of your patients, and you've been able to manage him from the time of the diagnosis and all that. But just talk to us about how time frame is very, very key, because even for him, having turned 1 year, he needs to get the treatment before he's 2 years old. How key is that?
So for SMA, especially SMA type 1, previously before there was treatment available, by 2 years of age, these patients, 95% would not survive by 2 years of age. So, and they would actually, the ones who survive would actually require permanent ventilation. They would need permanent ventilation for them to be assisted in breathing. So, but now with the onset of, with the current, especially the gene therapy, it has come to revolutionize all that treatment, in that the gene therapy has been shown that if it's given, it's a one-time off gene therapy. So you replace the abnormal gene with a functioning gene. So the muscles do not degenerate. And so this patient can actually lead a normal will have a normal lifespan. So past the 2 years, we have other, what we call disease-modifying treatments. These ones are supposed to help the body produce the protein. So we have what we call like risdiplam is available, and another medication called nusinersen, which are indicated for those patients. Then together with supportive therapy, nutrition, occupational and physiotherapy, and such supportive therapies, they are also able to, these patients are also able to benefit.
Okay. So in the case of baby Jason, what kind of gene therapy does he need? Now Jason is 1 year, so he still would benefit from the gene therapy, the Zolgensma, because that's a one-off treatment. It might be expensive, but in the long run, it's more cost-effective than the lifetime. The other available treatments are lifetime, and they are also very expensive. So in the long term, it becomes more cost-effective to use the gene therapy. Okay. It's very costly. And for a long time, it was known as the most expensive medication in the world, in that it will cost us about 250 million Kenya shillings, which is usually out of reach in the low and middle income countries. So, but there is a clinical trial which happened in China, which has produced
another low-cost gene similar to Zolgensma. This is the Besemno gene, which is less costly. It will cost about 15 million Kenya shillings. So with the similar mechanism of action as the Zolgensma.
Okay, and so the question will be 250 million or 15 million for that matter. How long does it take for, can I say, prognosis now, like, for the treatment to, for the doctors to determine that the treatment is working?
So this will be an ongoing process, because after the patient receives the gene, now you have to monitor the progress with time. So the main thing is being able to achieve milestones which the patient didn't achieve. If this patient was on ventilator, maybe they are able to get off the ventilator. If they are not able to move, then you monitor what type of milestones they are able to achieve with time.
Okay. So maybe there are parents listening to you right now, and what advice would you give them? These symptoms or these signs that you've talked about, what steps can they take?
So for parents, the first thing is to be able to, if they notice something unusual in a child, in a patient, in their infant, like the younger infants, less than 6 months, especially a weak cry, or generally a very floppy baby who's not moving, has no spontaneous movement. That's one of the red flags. If they are unable to control their head, because normally a child should be able to control their head by 3 months. So if they are not able to control their head, they are not able to sit by 6 months, they are not able to grasp and hold objects by 5 to 6 months. If they have a weak cry or a weak suck, or if their breathing pattern, they look like the chest is moving inwards, that might be a red flag to go to a pediatrician or to go to hospital for checkup.
From taking a step to lifting a hand, it depends on the strength and coordination of our muscles. But for those living with spinal muscular atrophy or SMA, even the simplest movements can become incredibly difficult. Signs and symptoms of spinal muscular atrophy vary depending on the type of SMA. However, all types share the core issue: progressive muscle weakness caused by the loss of motor neurons. Here's a look at general signs and symptoms of SMA. Regardless of type, SMA commonly includes progressive muscle weakness, muscle wasting or atrophy, poor muscle tone, that is floppiness, delayed motor milestones, for example sitting, crawling and walking, difficulty with movement like sitting or standing independently, lifting the head, swallowing or feeding, breathing in later stages, tremors especially in the fingers, weak cry or cough, and joint contractures or scoliosis due to prolonged weakness.
And so there you have it. SMA, spinal muscular atrophy, is a rare disease, but one that has a cure, and that is the gene therapy. Of course, very expensive, and so baby Jason is actually banking on you. So if you could do something, that would be much appreciated. And so on behalf of everyone who made this program possible, Anne, baby Jason's mother, and also the doctor, just trying to help us understand what SMA is all about and what gene therapy and how it works. And so on behalf of the production team, my name is Marie Ambo. Goodbye for now.